An EMT's Guide, BSI Scene Safe. 1. Trauma Assessment. When invited into the exam room, the examiner probably is going to give you a few minutes to familiarize yourself with any of the equipment you might find in the exam room. BSI Scene Safe. Mechanism of injury is a fall 15 feet. Based on mechanism, I would like to request additional resources. I'm going to request C-spin precautions, asking my assistant to get the C-collar. I am going to ask the other assistant to hold and maintain C-spine. The moderator will call out, "The head is now in line stabilization. I appear to have one patient female supine and there are no apparent life threats." I'm going to go ahead and assess the patient's mental status. Ma'am, can you hear me? Can you hear me?" whilst squeezing the patient's shoulder area to check for response. Stern a rub of the chest to assess. I then call out if or not the patient responds to painful stimuli. I'm looking, listening, feeling for breathing. I'm looking to see if anything is blocking her airway. Moderator replies, "She is breathing, airway is patent." I reply, "She is breathing, airway is patient." I'm palpating a strong and regular carotid pulse. It appears normal. Is that what I find? Moderator replies, "Her pulse is rapid and strong." Okay, rapid and strong. I'm going to initiate oxygen therapy at 15 liters per minute via duct non-rebreather mask to assure rapid ventilation and manage any injury I find at the airway. Moderator replies, "Patient accepts non-rebreather, seeing equal chest rise and fall. Do I see any major bleeding? If so, address. Patient appears warm, pink, and dry." Moderator replies, "Patient seems to be warm, pink, and dry." I'm going to define the transport priority as high and obtain a set of vitals and get a sample history from any pertinent bystanders or those who know the person. I instruct my assistant to obtain vitals, or do so myself. Moderator replies, "Your vitals for your patient that your partner finds are a blood pressure of 110/70, heart rate of 120 and respirations of 22 and weak 110. I confirm." Inspecting, palpating the head. What do I find? Looking in the ears, noting battle signs, raccoon eyes. I look in the nose and mouth, feeling down the neck. JVD and tracheal deviation are not present. Are eyes equal round, responsive to light? I'm going to auscultate the chest and inspect for lung sounds/ECT. Do I hear any wheezing or ronchi? I am going to go ahead and palpate all 4 quadrants of the chest. I want to check the hip bones. I'm going to assess the pelvic region/perineum for any trauma. Verbalize. Moderator response, I'm going to check the lower extremities. The patient groans over left leg. I material. Patient has an obvious deformity, open feature on the left leg. There is some bleeding but it appears to be minor. I take note and am going to return to it later. I'm going to check circulation, sensory motor function on upper extremities. Following, I assess the feet, having the patient if possible pressed down as well as the opposite. I check pedal pulses. Pedal pulses present. I package the patient for transport, checking the spine and posterior. I'm going to prioritize as high priority and reassess vitals every 5 minutes, performing an ongoing assessment to try and refine treatments. Next skill. 2. Medical assessment. BSI is my scene safe? My nature of illness is chest pain. I have one patient. I will not consider C-spine but I will consider ALS. ALS. My general impression of the patient is that I have a 50-year-old male in respiratory distress experiencing chest pain. He is in respiratory distress. Skin is pale, cool and diaphoretic. Airway is patent. Patient is in a seated position on the stretcher. Obviously, airway is patent, but I notice breathing is labored. First thing is going to do is apply oxygen at 15 liters per minute via non-rebreather. EMT to the patient, can you tell me what your name is? Patient, Mike. EMT, Can you tell me what time of day it is? Patient, it is the evening, EMT, and what did you call us for? Patient, chest pain, EMT, okay, we'll do what we can to get you taken care of. We've determined that the patient is alert and oriented times 4. I do not see any airway obstruction and the airway is patent. I go ahead and take the patient's respirations and multiply them by 2. The patient's respirations are 16 per minute but labored. I've already given him oxygen, so I'm now going to take a pulse for 30 seconds, multiply it by 2. His heart rate is 78, strong/bounding. I assess his skin color, temperature, and condition. It is pale, cool, and diaphoretic. I'm going to transport this patient because he is having chest pain. So we're going to load him into the ambulance and do the rest of the assessment in transit. We'll take a history of the patient sample, ask for signs and symptoms. Besides the chest pain, are there any other symptoms or issues that are concerning? The patient responds no. EMT, A. Are you allergic to anything? Patient, no. EMT, are you on any other medication? Patient, no. EMT, L. What was the last thing you ate? Patient, an omelette for breakfast. Me, the EMT, what events lead up to this chest pain? Patient, I was out in my yard. Can you describe the pain to me? Patient, squeezing. Does it move anywhere? Patient, I feel like it's in my left shoulder. EMT, on a scale of 1 to 10, where would you rate it? Patient, 8. EMT, is it constant or does it come and go? Patient, it is a constant squeezing pain. What I'm going to do ahead now is to look at the affected body part. Deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, swelling. I'm going to osculate the chest listening to the lung sounds. Are there any bronchi? Wheezing? Any fluid/ECT? Okay. __. Now I'm going to get a set of vital signs. I retake the pulse. Pulse is 90 beats per minute, strong and bounding. I assess breathing and it is still 16 times a minute but not longer labored. I take blood pressure, as we're in transport. Blood pressure is 180/120. With this information I'm going to call medical control and request permission to give aspirin and nitroglycerin. I suspect this patient is suffering a cardiac event such as an MI. I administer the medication and then I am going to reassess my patient after 5 minutes. Retaking blood pressure, pulse, how do you feel now? My secondary assessment. Next assessment 3. KED. After determining if my scene is safe and taking appropriate body substance isolation, I direct my assistant to hold C-spine and maintain manual stabilization. What finger am I touching? Squeeze them for me. What toe am I touching? Can you wiggle them for me? I go ahead and measure and grab the appropriately sized C-collar. After application I go ahead and get the KED. I fasten to torso first, all the time it takes for that. Next I secure the inguinal straps, using a back and forth seesaw motion, to help get the straps position underneath the patient's seat to adequately support the patient's weight while being lifted. After the chest and inguinal straps are set while my partner is still holding C-spine, I pad the back of the neck. I then firmly secure the chin strap. I next firmly secure the top head strap. My partner still maintains C-spine. I tighten chest straps and double check. With partners on heads count we move the patient to the ground to the long spine board. Next, 4. Oxygen administration via non-rebreather proctor. This skill is designed to evaluate your ability to provide supplemental oxygen administration by non-rebreather mask to an adult patient. The patient has no other associated injuries. This is a non-trauma situation and cervical precautions are not necessary. You will be required to assemble an oxygen tank and a regulator. You will then be required to administer oxygen to an adult patient using a non-rebreather mask. I will serve as your train assistant and will be interacting with you throughout the skill. Do you have any questions? I reply, no questions. At this time, please take 2 minutes to check your equipment and prepare whatever you feel is necessary. EMT, I look for tank, mask, hoses, bag, attachment, and O-rings and reply, I'm prepared. A 45-year-old male presents short of breath. His lips are cyanotic and he is confused. You have 5 minutes to administer oxygen by non-rebreather mask. Your time starts now. EMT, first of all I'm going to check BSI and that my scene is safe. I make sure my supplies are set. I am going to crack the valve to clear dust. I am going to assemble my regulator checking that there is an O-ring on there. I am going to open it up. I am going to check the pressure and listen for leaks. Next I'm going to prepare the non-rebreather and adjit, turning it up to at least 10 no more than 15 liters per minute. I am going to profile the bag, holding the 02 with my finger to fill. I'm going to put the oxygen over the patient's face. I'm going to tighten it until it is snug and over the patient's face, and I'm done. Next, again repeat skill if necessary, practice in person at ECT5. Blood glucometry. Administer oral glucose per EMT standards for hypoglycemia, sanitize and bandage site and if out of norm transport apply appropriate intervention per EMT guidelines. Next, 6. Immobilization BSI scene safe, forearm fracture, immobilize the arm, have them hold still to the chest and high enough. Before applying the stabilization device I'm going to have check fingers. I'm going to measure out and make sure that I'm immobilizing above and below the injury. If it is a forearm fracture I'm going to immobilize above the elbow down to the wrist, pad the splint as needed. I place on the patient's arm and I'm going to ask the patient to hold it still and steady in place. I'm going to carefully wrap while holding the splint snugly without cutting off circulation. I wrap all areas except the fracture site. I'll have the patient hold onto a roll of gauze. I then sling over his arm. I recheck the pulse. I check his reflexes. I recheck pulse, motor and circulation and go from there. ________________ *7. Bleeding and shock management, BSI. I'm going to apply direct pressure and bandage the patient. Does bleeding stop? I am going to ask my patient to maintain pressure or ask my partner to apply while I hold the tourniquet. I apply the tourniquet 2 inches above, proximal, to the wound, ratcheting it up until bleeding stops, then securing. I make sure it is not on the joint. To hold firm and prevent damage, I'm going to make sure that the hold's firm. Tourniquet is applied. Is the wound still bleeding? The bleeding has stopped but the patient is showing signs of hypoperfusion or shock. I'm going to position my patient appropriately, that is supine, making sure the pressure is maintained adequately as possible. I'm going to elevate the feet at least 6 to 12 inches and I'm going to apply 02 via a non-rebreather at 15 lpm, and immediately transport the patient, and that is all. 8. Blood glucose measurement should be considered for any patient with an altered level of consciousness. Always use appropriate body substance isolation. Use all proper items including. Make sure the unit is calibrated and check the expiration dates and make sure the test strips aren't damaged or bent. Prepare all the proper items including the glucometer. Prepare the finger with an alcohol prep pad. Allow the finger 30-second dry. Turn on the unit if it already has not automatically. Poke the finger with the lancet to obtain the blood sample along the side, milking if necessary and applying to glucometer. Make sure to put the lancet in the sharps container. Normal glucometry. Turn the unit on by following the manufacturer's recommendations. Record as milligrams/deciliter with normal range as 70 to 90 milligrams per deciliter, NXT. 9 AED. You are pushing oxygenated blood throughout the body, the better results persist. BSI scene safe. I'm going to go ahead and see if the patient is responsive by tapping shoulders. Are you okay? Are you okay? Look to see if chest is rising. Listen for breath sounds. Feel for cardioid pulse. All this for no more than 10 seconds. I'm going to go ahead and ask for additional resources and get the AED. I do not feel carotid pulse. I'm going to begin chest compressions at 30 compressions to 2 breaths. I'm going to manually open the airway with the head tilt chin lift maneuver. If the patient fell/we suspect spinal trauma, then we implement the jaw thrust. If their chest is especially hairy or they are especially sweaty, diaphoretic, we put the chest pad set just a little bit, ensuring appropriate skin contact. With breaths delivered between 2 and 5 seconds each, observing for adequate chest rise and fall. I open and turn on the AED, plug in the pads, attach pads to patient and press the analyze button. I follow instructions loudly announcing shock and either continuing compressions or shocking as AED prompts. As the patient returns to consciousness, I put on high flow O2 and prepare for immediate transport, rechecking vitals every 5 minutes. If needed, play back at slower speeds and repeat to confirm. 10. Emergency childbirth. BSI scene safe. How far along are you? How far apart are contractions? How many births have you had? Ask if I can lift up her dress. I do see deliver is imminent because there is crowning of the head. I'm going to go ahead and prepare my OB-KIT. I'm going to prepare my wipes anterior posterior down, L. I'm going to go ahead and put on my sterile gloves and create a sterile field for birth. I'm going to go ahead and fold this pad. I'm going to ask the mom to lift her hips up so I can place mat beneath her. Drape this side, drape the other side. I'm going to go ahead and give birth to the baby. Take the APGAR score at 1 minute, wrap the baby in a blanket. I'm going to go ahead and put the first clamp 6 in from the baby, the second 2 to 3 inches distal from the first from the baby. Once the umbilical cord stops pulsing, then cut. After I cut the umbilical cord, I reassess the APGAR score at 5 minutes, then place the baby to the mother's breast. I'm then going to wait for the mother to birth the placenta. As soon as the placenta comes out, I'll be sure to place the placenta in a bag. I'll be sure to have this transported with the baby and the mother. I'm now going to attach a bracelet to the baby and then one on the mom for identification. I'm going to make sure the baby is to the mom's breast and assess her for any bleeding. If she's bleeding, I'm going to keep the baby to the mom's chest and then massage fundus. * patch up, bag valve mask. 11. Naloxone administration. Atomizer. The EMS provider will provide an adequate airway and ventilatory support before and after application. Pop the protective cap off the protective vial and hub. Screw the medication into the hub using G2 to 3 turns and attach the atomizer. Administer 1/2 of medication fluid into each nostril. Observe the patient for signs of consciousness. Increased breathing. 10b/minute. Eye movement. Moving extremities. Responsiveness. Use caution as the patient may become combative. Pause or repeat to practice activity as necessary. 12. Penetrating chest wound. BSI scene safe. Open the dressing, locate the site. When applying occlusive dressing to a sucking chest wound, we create flutter by taping down 3 of the 4 sides, leaving the bottom side open for drainage, allowing air to escape and preventing air from entering. Apply oxygen therapy at 15 liters per minute via duct non-rebreather mask. Call for transport and package. Pause to reflect or repeat activity. 13. Epinephrine auto-injector administration. I take body substance isolation and make sure my scene is safe. In case a patient is going into anaphylactic shock, if that person needs the EpiPen and are unable to perform the task themselves, it has to be prescribed to them. You cannot use some else's. Yes, make a fist no holding either end. An EMT's guide. Themselves, it has to be prescribed to them, you cannot use some else's. Yes, make a fist no holding either end. An EMT's guide. Call for transport and package. Pause to reflect or repeat activity. An EMT's guide. BSI scene safe. 1 trauma Next skill. 2 medical assessment. Airway is patent. I'm going to so we're going to will deform. With this information I'm going call. Transport the baby and mom to the same hospital . Call for transport and package. Pause to reflect or repeat activity. 13. Epinephrine auto-injector administration. I take body substance isolation and make sure my scene is safe, in case a patient is going into anaphylactic shock. If that person needs the EpiPen and are unable to perform the task themselves, it has to be prescribed to them. You can. An EMT's guide. BS1 trauma assessment. An EMT's guide. An EMT's guide. BSI scene safe. 1 trauma. Epinephrine auto-injector administration. I take body substance isolation and make sure my scene is safe, in case a patient is going into anaphylactic shock. If that person needs the EpiPen and are unable to perform the task themselves, it has to be prescribed to them. You cannot use some else's. Yes, make a fist no holding either end. No holding either end. Pull out the safety cap, aim for the thickest part of their thigh on the out part, take pen at a 90-degree angle, stab straight down, hold for 10 seconds and then pull the pen straight out, put the cap back on and dispose in a proper needle container, monitor the patient, apply 0-2, and go from there. Watch and make sure they're breathing better. An EMT's guide. BSI scene safe. 1 trauma assessment. When invited into the exam room, the